Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. Mycophenolate Mofetil. It is isolated from Penicillium stoloniferum. Available in 250 mg capsules, 500 mg tablets, 100 mg per ml oral solution. It is rapidly absorbed from the gut. Reaches peak within 1 hour. Again, a second peak comes after 6 hours. This second peak is due to enterohepatic circulation. 94% is bioavailable. 97 to 99% of the drug is bound to albumin. T-half is 16 to 18 hours. Metabolized in liver. First of all, this prodrug, mycophenolate mofetil, gets converted to mycophenolic acid, A for active metabolite, via esterases in liver, plasma and kidneys. Later, this mycophenolic acid is glucuronidated to mycophenolic acid glucuronide. This glucuronide is water soluble and is easily excreted via kidneys. Majority 90%, rest of the 10% will enter gut. In gut, beta glucuronidase again breaks down this glucuronide and converts mycophenolic acid. This is the reason for second peak. Again, this mycophenolic acid enters the liver and then again to mycophenolic acid glucuronide. This beta glucuronidase is also present in epidermis. Thus, we can use this drug for various dermatological conditions. Coming to mechanism of action is mainly immunosuppression. This mycophenolic acid, which is an active metabolite, inhibits inosine monophosphate dehydrogenase selectively in activated lymphocytes, thus inhibiting inosine monophosphate getting converted to purines. Thus, there is no purine synthesis, exhibiting immunosuppression. Coming to FDA approved uses, only one use is organ transplantation. Off-label uses are immunobullous diseases, autoimmune connective tissue diseases, vasculitis, pyoderma gangrenosum, sarcoidosis, chronic urticaria, chronic actinic dermatitis, psoriasis, lichen planus, pharmpholics, atopic dermatitis, lichen planopilaris. Here, one more drug is there which also inhibits purine synthesis, that is azathioprine. We should never combine these two drugs because of bone marrow suppression. Coming to contraindications, absolute contraindication is pregnancy and lactation because it is a category D drug and a teratogen, hypersensitivity for any drug. Relative contraindication is peptic ulcer disease. And live vaccination. Whenever we are giving a immunosuppressant, we should avoid live vaccines and we should check for TB before starting immunosuppressant. Significant renal, liver, cardiopulmonary diseases. Coming to adverse effects, GI adverse effect, nausea, vomiting, diarrhea, abdominal pain because it is undergoing extensive enterohepatic circulation. GU side effects, frequency, urgency, dysuria, hematological pancytopenia, bone marrow suppression risk increases when you combine with azathioprine. Infections because we are suppressing immunity, teratogenic and carcinogenic. Neurological side effects like weakness, fatigue, headache, insomnia. These drugs, antacids, proton pump inhibitors, these both will disrupt enterohepatic circulation and will reduce mycophenolate mofetil levels. Steroids and cyclosporin also will reduce. Drugs which increase mycophenolate mofetil are aspirin and phenytoin. These both will bind to albumin and makes mycophenolate mofetil free from bound state and elevates the levels of mycophenolate mofetil. As we already discussed, azathioprine increases the risk of bone marrow suppression. Investigations and monitoring, CBC, LFT, RFT, firstly 2 weeks once. When we are increasing the dose from lowest dose to desired dose, when once desired stable dose we are keeping, then we can do 3 months once follow-up. HBsAg, anti-HCV, pregnancy testing. Before starting the drug, we have to check pregnancy and TB, tuberculin test, MON2 test, purified protein derivative test, all three are same to check whether patient has latent TB or not. Remember the channel name. Don't forget to like, share and subscribe. Thank you. Hasta la vista. До свидания.